I'm Laura Findeiss. I'm the current president of the SIR. One of my passions that I'd really like to pursue over the next year is our global outreach program. What we've seen over the last few years is a lot of traction in the efforts that we've been making to connect with societies internationally to grow access to IR for communities around the world. As we're focusing internally in the United States on access to care, we also want to focus externally to access to care because we believe that global health improves as we're all getting access to the standard of care therapies for different disease states. We've received a lot of enthusiasm from societies in countries around the world who are trying to grow their footprint in IR. And one of the things we keep being asked is about certification and training and universal curricula, which are things that we're working on here in the United States. Some of it is infrastructure. I mean, there's a lot of, depending on the community, right? There's a lot of limitation in the ability to build the infrastructure to supply interventional radiology. And a lot of, be honest, a lot of locations around the world have immature enough health systems that IR is probably not the priority. They're still building their primary care networks. But even in those areas, some of the smaller procedures that we do that are interventional radiology can still serve a great purpose. Beyond infrastructure, what we're really hearing is that there's a lot related to training and certification, and that there's a lot related to government recognition of IR as a specialty so that there's no payment structure around performing the procedures that we do. Different specialties have been either trying to hold on to the procedures that they do and not open to the innovation that we're bringing into the countries. And we're seeing, again, a lot of the same sort of activity we saw here in the United States worldwide of having to really promote what we do and help people to understand how it helps the health of patients ultimately. A couple of the areas where we're having a lot of collaboration, specifically around certification, are in Egypt and now in India. We've worked with Egypt for several years to help them develop their training examination so that they can develop a certification, which then becomes the next step in government recognition of the specialty. And now, although we know there are robust training programs both in Egypt and in India, now in India, we're helping well-trained interventional radiologists now get access to a certification exam that's appropriate for what they do in India and appropriate for that local environment through collaboration. And that will then lead to recognition of the specialty, which will then is really the glide path to the next step, which is growth of the specialty.